everyone, until I start the class. So you might see a little sign talking about YouTube. I'm going to start the class now, and I'll sort of begin with a bit of a game. All right, so here we go. Starting now. Okay, so this is OET speaking. We're talking today about introducing yourself. All right, so it's just the first thing you do when you start your OET speaking exam. After your 3 minutes of preparation, you've got to begin. How do we do that in a way that is, really high quality, in a way that ensures that you're going to get a good grade? Okay, so can everyone see my diagram here? Does everyone see this?
Yes.
Okay, so we'll talk about this in a minute. I just want to start with a quick game. So we'll do 2 quick games. Game number 1 will be the grammar game again. So I'm going to type a word, and you guys just shout out what the form of the word is. So, for example, if I say cup, you guys will shout
No.
So this should be a nice, easy game, and everyone is welcome to put their microphone on. Okay. So what about something like transfer? Verb. Like he is due to be transferred, right? This is a verb. Okay, someone's trying to get into the class. Okay, what about something like, how about this? Joint.
Noun.
Noun, right? A noun, and it's the joint on your leg or on your arm, right? The thing that allows you to move. What about join? Verb, meaning to connect, right? What about something like admission?
Noun.
A noun. What's the verb?
Admitted.
Okay, now here's a difficult one. Aforementioned.
Most
Is it not a noun?
Adjective.
Adjective, yeah. Okay. What does it mean? Does anyone know what this means?
Therefore explained.
Yes.
We use this very often in OET, and we might say she underwent the aforementioned surgery. Okay, so this is an adjective describing, what's it describing, guys?
The surgery.
Okay, fantastic. Okay, so that's a quick game. We've got the second game. Mohiba, can you say hello?
Hello, yeah.
Just a quick game to get us warmed up. You're going to be my patient, okay?
Yeah.
I'm going to type today. Guys, Mohiba is going to be my patient. I am going to be the doctor. And you just need to listen to my introduction, okay? Tell me, is it good? Is it bad? What am I doing right? What am I doing wrong? Okay, so here we go. 3, 2, 1, go. Hi there, Mohiba. Thanks for inviting me into your home.
Thank you. You're welcome.
Can you just confirm your name, please?
Yeah, I'm Mohiba Rosbahan.
Okay, great. So, what brings you here today?
Yeah, Alan, as doctor, as I maybe you noticed that I had a surgery. So 2 weeks ago. So now you come to see me.
Okay, no problem. And are you sleeping very well at the moment? And are you taking any medication?
Yeah, a lot. You can see I had lots of medication for my previous problem, as well as they added after the surgery. Some antibiotics at the moment they added, and also some pain relief as well.
Okay. All right, stop there. What are my errors? So many errors. What
First,
here? Ismail, go on, Ismail.
First, you studied that it was a home care meeting. You went to the home of the patient. First of all, the patient was known for you, and after that, you asked, "What's your name?"
Well, there's 2 things there, Ismail. Good. So, first thing, it was a home visit. What did I say that was not appropriate for a home visit?
Yeah, thank you for coming and see me.
What brings you
home?
Yes.
Brought you here. Yeah.
Yeah. So you can't say thanks for inviting me into your home. What brings you here?
Yeah, so that's the thing.
You live there, right? So that was an error. Also, was it a known patient or unknown? It was confusing, as Ismail said, because I used her name and then I confirmed her name. What else? There was other mistakes as well.
No empathy.
No empathy. It always makes me laugh when you do no empathy. What did it sound like with no empathy?
Very
Don't care
rude.
about her.
Terrible, isn't it? Okay, so last one. Did anyone hear the if you look at the-
Compound question.
Yeah, Sarmila, there was a compound question. What is that, please? What is compound question?
I forgot exactly, but I remember you asking two questions.
Yeah, so it's two questions. Anyone tell us what it is? Two questions at the same.
With conjunction.
It was how do you feel and was are you taking some medication?
Yeah. Guys, remember in OET, they don't like it when you ask two questions at the same time, right? Like, are you sleeping very well? And are you taking any medication? All right, you have to ask one question, then response, then second question. You can lose marks in OET. Okay. Was there any other errors? I think that's everything. Was there anything else that I missed? Maybe I forgot something. I think that was it. Okay, so guys, these are just games. Today, what we're doing is we're going to talk about introductions. Okay, so this is what we're studying, introducing yourself. Tomorrow, you will have Paul, and he will be reviewing today's class. And then Wednesday, you'll have Lawrence. Okay, and basically for this whole week, we're just going to practice introducing yourself. Okay, starting the dialogue. And in this class, what I want to do is start by saying, how should we introduce ourselves? Okay, maybe you guys could give me your ideas. Okay, then we're going to look at the criteria and we'll see what do OET say. Okay, so what do OET sort of advise us or say? And finally, at the end of the class, I'll make the diagram that I always make, which kind of shows you different options, okay, for introductions. So that's the structure today. Let's get started. Could I ask to speak to Olga or Eda? Could you guys say hello?
Hello.
Eda. Olga, simple question. How should we introduce ourselves in OET? What do you think?
Probably we have to begin like, hello, my name is Olga. For example, I'm one of the nurses.
Okay, so give your name. Yeah, your name and role. Good. What else? Eda, Khwaja, what else do we do?
Welcoming the patients. So,
Confirm the name of patient.
Welcome them, maybe, if
yeah.
they are,
Then,
depends where we are, right? If you're in their house, can't welcome them.
Patients.
Yeah.
We can say, can I just confirm your name?
Confirm name of patient.
Their name. Yeah, good.
Yes.
Anything else, guys? Shout
The
out.
Context.
Say that again, Farouk.
Yeah, say context. For example, I'm aware that you have this problem.
Yeah, like I'm aware that.
And, yeah.
Or
An
I can see from
IPP.
your notes. I can see from your notes that as you're a doctor, right? Anything else?
IPP.
How are you feeling at the moment?
Ismail.
Yeah, how are you feeling at the moment? Or we can say what bring you today?
So some kind of question, right? Question, how are you feeling? What brings you here today? Etc.
How can I help you?
Maybe how can I help you? Yeah, we'll talk about all these things today. Okay. Is there anything else? Do we have to smile?
yeah.
I think, Roger, there's no video camera, so it's audio. They will record you and you don't have to smile, I guess, if you don't want to. Anything else that we need in introductions?
Be respectful.
Yeah, kindness, respect, maybe a bit of empathy as well. We could put this here.
And can we say nice to meet you?
Yeah, these kind of things, nice to meet you, or you can say nice to see you again. So these are kind of like friendly phrases, right? Like nice to see you again or meet you.
Yes. And Alan, I think intonation is very important.
Yeah, so let's put this here. When you say intonation, I'll call this tone. Intonation or tones, same kind of thing. Could you demonstrate what do we mean by this?
Yes, for example,
equaling?
you're talking, for example, about the age to people. You have to talk like you're talking with a big person. It's different to talk with a child. And
Yeah.
also, while you're talking with someone, they have a problem, for example, cancer. You have to demonstrate the things that you can show, put yourself in the patient's shoe and show the empathy and sympathy, you know.
All
The
with
way
the
that,
sound, yeah, with the sound of the voice, like soft,
yeah,
right, or
so,
not,
yeah, not
maybe.
too much harsh, yeah.
Definitely, all of these things are really, really important. Okay. Now, different OET teachers will say different things. The problem is that, you know, different people will give different advice. So what I always try and do is just focus on the exam, right? What do these guys say? What does OET say about introducing yourself? That's where we should start, okay? Because we're all here to pass OET. We're not learning in general how to introduce ourselves. We're talking about the OET exam, okay? So shall we look at the criteria? Let's look at the criteria, all right?
Yes, please.
How many sets of criteria are there? Does anyone know? How many
There are two.
Four of criteria? Well, there's actually two groups. Okay, so there's two criteria. One is called the, does anyone know?
Linguistic,
You can all shout out. And Atik, Anna, could you say hello? Nyok, what's the other type?
Hello.
Hey, Anna, what's the name of the other? There's linguistic criteria. What's, for anyone who's new today, what's the name of the other criteria?
IPP or communication.
That's a good example.
Clinical communication.
Say it again, Anna. That's correct.
Clinical communication criteria.
Yeah. Fantastic. So clinical communication. How do we spell communication, everyone?
C-O-N-N-U-N-I-C-T-I-N.
You can all shout out.
Double M-U-N.
Yeah,
that's right.
So there are two criteria, and the one that talks about introductions is this one. Okay, if you want to know about introductions, we need to look here. There's nothing really in the linguistic criteria about that. Maybe you can be judgmental, perhaps, with your introduction, but in general, we're looking here to understand what OET say about this, right? So what makes a good introduction? We have to ask OET. OET have two criteria. This is the one that really talks about it, okay? So let's look at the criteria. I'm going to show you the criteria now, okay? And I want you guys, very simple, I want you to get your pens and draw on my screen on the criteria where you think they will talk about introductions. Is that clear, guys? You can practice your pens now. Practice now. There's Sam Miller. Fantastic. Okay, so you know where the pens are. Okay, so you found the pens, some of you. Okay, let me.
I don't know.
It's like the top or the bottom, Lucinda. Sometimes it's on the left as well.
Oh, okay.
Look for a pen image. Okay, so here's the criteria. This is the clinical communication criteria. And where do we see introductions here? Can anyone see the word introduction mentioned? Ooh, a lot of things are in relationship building. Okay. Nyok, do you think that introduction is here as well? Or Nyok, do you prefer it to be here? Could you say hello, Nyok? This is you. Oh, I think he said he couldn't speak. I think, Nyok, you were trying to look at this one, right? Because I think a lot of people in this class know already that it is in relationship building. Okay, this criteria here, relationship building, where they talk about introductions. What about Norzad? Could you say hello? Or there's a few quite experienced people here. Mary,
Yeah.
is there maybe another place? I don't know. what you think. Sometimes it can be more than one place. Do you think there's any more? Maybe, I don't think so. None of these really are related, are they? I think it's just A1. So guys, OET talk about how to introduce yourself in the very first criteria here, okay? A1, it's called, in the clinical communication criteria. Let's have a look and see in more detail what they say. All right, so I'm going to zoom in now. Let's look at this bigger, okay? Here it is, relationship building, the same one, okay? And we're looking at A1. Anna, would you mind reading this to us? If you don't mind, Anna, or we could try Ola, Franca as well, whoever wants to put the microphone on. Lucinda, try this. Anna, okay, go on. Can you just read this A1? What does it say?
Initiating the interaction appropriately, greeting, introduction, nature of interview.
Yeah, so where is introduction? Are there any words that kind of mean introduction here?
And the bracket. In the bracket.
I suppose we have introduction in brackets. We have this one here, yeah. What else?
Greeting,
Greeting is an introduction, isn't it? Greeting is an introduction. Introduction is introduction. And also, yeah, thank you, Burhan. Can you say hello, Burhan? Initiate. What does it mean, guys? Initiate.
Start. To start something.
Okay. So this is definitely the place we need to look. But I always like to focus on one thing here. There's a very important word here. Can anyone tell me?
Is interaction?
Interaction is important, but OET are giving us a very important word here.
Appropriately.
Yeah. Okay. So Mary, can you say that again for us?
Appropriately.
Right. You get this word in the writing as well, right, doctors? You get this in writing, and you get this in the speaking as well. It's very important for a practical exam to talk about what is appropriate. So what does that mean, guys, appropriate? Does anyone know?
In the right way?
Accordingly. Correctly for situation.
Accordingly is a good one.
Correctly for situation.
Correctly.
Related.
Correct for the situation.
Yeah.
Situation. Anyone else?
Fruit in the cake.
Related to the situation.
Fruit in the cake. Yeah, it's my cake example. It's something that is right. Or in that place, right? Something that is correct in that situation. So, for example, if I say, "Hi, Mohiba, can I just confirm your name, please?" Is that appropriate? It's not appropriate, is it?
No.
Do I have her name or do I not have her name? If I'm going to use her first name, that seems like I already know her, right? Or is it appropriate for me to say, "Thanks for inviting me into your home. What brings you here today?"
No, that's not right.
Like I'm confusing the situation, right? This is what OET are saying, I think. Your introduction has to be correct for the situation in the cue card. And that's where we can start. This is where we should start. Okay. Does anyone have any questions on this? We need to be appropriate. Yeah, Rita, please.
Hi, Alan. Sorry, I was asking about if we know already the patient, but we could say that, can I confirm your full name and date of birth, like for example?
Yeah, well, let's discuss that, because sometimes when you do know them, maybe you can say, "Can I confirm it again?" or something like that. You could still do it, but you have to be clear that you know what I mean, that you don't confuse the patient. All right. We'll talk about that in a minute. For me, appropriate means two things. If you've seen my classes before, I always like to focus on two things that we need to worry about in OET. Okay. The first thing we need to worry about when we talk about appropriateness is situation. right? Where are we? How many different situations are there in OET usually?
Three.
Three, Layla. Yeah, exactly. Ezgi, can you tell us what these are? These three situations?
We can be at home,
You can be at home,
can be a clinic
clinic,
or hospital ward,
hospital.
maybe emergency department.
Is there more than that though? Can we be in a school? Is it possible?
Yeah.
Not very common, but sometimes.
It's not common. So I'll just put other here. There are other ones, but they're not common, are they? Other not common ones. Rahim, do you want to ask a question?
Yes, it's like they've added school to it now. The one I did in September, I did school children or something like that.
Okay.
Yeah.
There are others. How was it for you? Did you feel bad or was it okay? Because I think if I was doing the exam, Rahim, and I got in a school, that might make me more nervous. Were you okay when you did it?
Sorry, Alan. Maybe school come for nurses because all school has their own nurse, but maybe care home come for doctors.
Yeah, well, I just think we need to have, it's possible to have something different, okay? And I'll talk about that today, how we can prepare for that. If you get a school, I'll explain how to do a school, okay? But we have to have a correct situation, okay? Another really important thing with an appropriate introduction is what? What's number 2 here, guys?
Known or unknown patient.
Say that again, sir. Correct.
Known or unknown patient.
Yeah, Bunyamin. So what do you mean by that? Can you explain?
Sure. If we already are familiar with the patient, of if we have already met before, we can just start our conversation with "Hi, Alan. Thanks for coming in today. How are you feeling at the moment?" Or if we we don't know the patient, we can start with "Hello, my name is Bunyamin. I'm one of the doctor. Can I clarify your name?"
Exactly, right. Now, in my experience, nurses and doctors worry about this a lot. Does anyone here worry about known or unknown?
No.
Who gets
I don't actually.
No.
Good, because
yes.
I want to stress that, look, if you make a mistake with this one, don't worry, just continue your exam, okay? You're not going to fail if you get this wrong. What you need to do, though, is be consistent. What does that mean, guys? Consistent.
Follow the same
keep repeating.
Same one, right? So, Layla, don't say, "Hi, Mahiba," and then say, "Can I confirm your name, please?" Right? If you do it as known, then just say, "Hi, Mahiba. Nice to see you again. How are you feeling today?" Right? You just continue. Don't worry if it's incorrect. You won't lose. You can still pass your exam if you make a mistake here. Rita, go on. Question?
With the known and the unknown, can I say it in this case? Maybe if the client has been on a ward and is being discharged, depending on the cue card, the situation that we have at hand. So maybe if a patient has been discharged, then you already know the patient on the ward. So that one would be a known case. But unknown maybe with the one like a school case that you don't know anything about it. And you are a community nurse to be educating somebody on something.
Exactly, Rita, it just depends. So think about the situation. And if you're not sure, guys, ask before you start. You can ask, do I know the patient? You're allowed.
Okay, thank you.
Now, what I always say, guys, is very simple is, okay, so we have 3 normal situations, right? You've got 3 here, and you've got 2 possibles, known or unknown, okay? So if we're going to practice OET, what we need to do is, how many introductions do we need to learn?
6.
Of course, for all of them.
Right? 3 times 2. 3 times 2, right? So I need to learn home visit known, home visit unknown.
Yes.
Clinic known, clinic unknown. Hospital known, hospital unknown. Of course, you can get more situations, so it's not only 6, but that's where we start, okay? Is anyone new in OET today? Has anyone not done the exam before? Who's never done the exam before?
Me.
I've not done it before.
Me neither.
And also, even the Norzad and Mary, you guys can practice this. You can make it really professional and smooth, automatic, right? So you don't really even have to think. So this is a very good thing to study. We're going to look at 6 different possible introductions, and then we'll talk about other situations as well. Okay, so this is what I normally do, guys, in this class. I talk about this diagram. This is a diagram. We're going to have here known, and we're going to have here, we're going to have here unknown, and we're going to have here known. Okay. On the left, we're going to have clinic, or we can start with a home one. We can have clinic. And what's missing, everyone? What's missing now?
Hospital.
Hospital.
So we can say 1, 2, 3, 4, 5, 6. Okay. But I'm going to add in today other, right? Or extra. Yeah. And we can talk about what possible situations we have. Okay. Now I'm going to try and do this in a more kind of interactive way today. So we're going to play a game. I'm going to do an introduction, and I want you guys here to tell me, does Alan know the patient, and where is he? Okay. So it's very easy. You just need to listen to me. Okay. So first one. Hi there. Thanks for coming in today. Can I just confirm your name, please? Okay, fantastic. I'm aware that you've been having problems recently with your medication. So how are you feeling at the moment? What's that, everyone?
Unknown.
Unknown patient.
No.
Is it known or unknown?
Unknown.
Known, right?
Unknown.
What did I say?
No.
Is it home, clinic, or hospital? Sorry.
Clinic or hospital?
Hospital.
I said thanks for coming in today.
Clinic.
Clinic.
We don't normally say that in a hospital because it's not very nice to go to hospital, I guess, right? What did I do right at the start? What did I do?
Nice to see you again.
Can I confirm your name?
I confirmed the name. Yeah, I confirmed the name. So I said, can I confirm your name, please? What else did I do?
Context.
Greeting.
I gave context. Norzad, what did I say?
Purpose.
It's about the
I'm aware.
Just Norzad, please, guys. Please keep your microphones off.
about the medication. I think you mentioned something.
Yeah, so I think I said I'm aware that.
Yeah.
What did I do right at the start, everyone?
Greeting.
Introduce yourself.
Did I give my name or did I forget? I can't remember.
No, you didn't give your name.
No.
I always forget to do it. Okay, so we need to greet and give name, right? So how do we do that, Norzad? What do we say?
Just I'm Dr. Alan, and today's
Hi,
doctor.
Andrew.
It's a clinic, one of the doctors in this GP surgery.
Yeah,
Or your doctor.
It could be nurses as well. I'm one of the doctors and one of the nurses in your GP surgery. Okay. So can everyone see this here? This is a clinic introduction. Greeting, give your name. Okay. Hi, I'm Alan. I'm one of the doctors in your GP surgery. Okay. Can I just confirm your name, please? What happens after I confirm the name? Is there an extra question as well? Do you know what I mean?
Yes.
Do I say something else? Can I call you?
Can I take your full name, maybe?
With your surname or with your name?
Yeah, for example, right, you might say, can I just confirm your name, please? And they will say, my name is John Smith. And then you say,
Can I call you John?
I call you John, right? And Davinci, if you say, can I confirm your name? And they say, John, what do you say?
Can I take your full name?
Yeah,
Full name.
right? Can I take your full name, please? Sorry, can I just confirm your full name, please? Okay, great. And then you can say, can I call you John? Okay. So this is the introduction for a clinic, right? Is there anything else we need to do? Is there one more thing? What's missing?
How can I help you?
IPP.
Yeah, so you can say, I like how are you feeling?
At the moment.
I like that one. Okay.
Or what brings you here today?
You can say that now. If you say what brings you here today, right?
Should be the first, yeah, before the context, yeah.
It can be no, it's like a contradiction, isn't it? For us. If I say, I'm aware that you're having problems at the moment with your medication.
Yes,
What brings you here today? It's okay, but it's this you are saying, I know why you are here, right? So,
Alan,
go on.
About the context, it depends on the cue card. Sometimes there is no
exactly.
There is no context. You cannot say at the beginning that I'm aware, but it depends on the cue card.
Exactly. And I've kind of prepared this today, Norzad. Guys, we're going to do this like this. Look at this. Let's think about what is essential and what is additional. Because not all of these things are essential, right? What is essential in an unknown clinic? Like, I must do it. Can anyone tell me? Do I have to give my name?
Your name?
Give name.
Essential name.
What is essential?
Give name, confirm name.
Roger, could you say hello, sir? You tell me. So giving the name, that's essential, isn't it? What else is essential?
That's important, yeah. Confirming the name of the patient is important.
And anything else essential?
There's also greeting, but
yeah, how are you feeling? That's also important.
Yeah, the greeting is here, Norzad. I'm not going to.
Okay. Sorry.
This, I suppose what should we call this? I'm going to call this. Well,
IPP.
It's IPP, isn't it? But anyway, these things are essential. These ones, as Norzad is saying,
addition.
Yeah. So you can do them. Usually you can do them, but you don't always need to do it. Especially thank you. You don't always need to say thank you, and you don't always need to do this, but it's very useful. Okay. All right. So what about a home visit? If I just copy paste this now, is this correct?
No.
No.
So Lucinda, could you say hello, Lucinda? Why is that not correct? If I just copy paste, why is it not the same?
Because there.
I'm going to home.
You say
Thank you for coming today.
Hey guys, just remind you, we're on Zoom, so if we all speak at the same time, it's tricky. I'm trying to control it. Okay. So Lucinda, if you can come back.
Yes, so in this case, we can say welcome or maybe thanks for coming in today.
Yeah, we
because
can't.
It's home.
Exactly. So what can we say if we're in their home, guys?
Inviting me or letting me.
Thank you for inviting.
Inviting me. Okay. Don't say that. I don't like letting Norzad because that sounds a bit strange to me. It's like, why would they not let you? You're a doctor.
But I mean, to be honest, then the patient not inviting us. This is the GP is doing follow up and going to the patient homes, but the patient never invite. Please come to my home.
To me, it sounds a bit strange. It sounds like you're a criminal or something. I can't explain it, but it sounds weird.
Okay.
Like, thanks for inviting me. Everyone knows I'm bad, but anyway, it doesn't matter. So, is there anything else we can change? Is it the same, guys? I think it's the same. Apart from...
Yes, it's the same.
Yeah, okay. What about hospital? Is it the same with the hospital?
No.
Well, from inviting, yeah.
Let's ask Ismail. For putting your hand up, sir. What's wrong with this now in the hospital?
In the first...
Just Ismail. Come on, guys. Just Ismail. I'll bring people in. If you've got a question, put your hand up. Ismail, go on, sir. What's wrong with this? Something incorrect here, right? Ismail is gone. I think I've muted you, Ismail. What about, how about someone slightly different who has not spoken yet? Khalida? Could you say hello, Khalida? Or Mehdi?
Hello.
Can I say thanks for coming in today?
No, in hospital, no.
It doesn't really work, really, usually. Okay, so I usually say no. Okay. Maybe if it's like an outpatient clinic, Alida, maybe outpatient clinic. Can I do this? Hi, I'm one of the in your GP surgery.
No.
Yes.
What, I
In
can't.
this hospital. In this hospital.
In this
No.
hospital, right? Thank you. In this hospital, on my terrible typing. Should I confirm the name? Yes. Should I give
Yes.
context? Maybe. Ask them how they're feeling. Yeah, ask them how they're feeling. It's always important. Okay. So look, guys, this is an unknown. These are the kind of introductions you need to do for unknown hospital, clinic, or home. Martinova, do you have a question for me there?
Yes, Alan, sorry. Just I want to ask about home visit. Is it okay to say thank you for having me today, or
Thank you for having me today. Yeah, I think so. Yeah, you could say that. Thanks for having me today. Yeah, it's also okay. Yeah, good question. Okay, what about unknown now? Sorry, what about known now? Olga, I know you have a question, Olga, but can you help me with this?
Yes.
Do I need to say all of these things if I know them already? Do I need to?
No, you just say hello and just say the name.
So you're going to say hi plus
Hi.
name. Okay.
Yeah.
What's next?
Probably
Can I-
asking how do they feel at the
Reading
moment.
is important again.
Can I say thank
but-
you?
Yes.
Yeah, I can say thank you, right? So hi, Mohiba, for example. I'm in Mohiba's home. Hi, Mohiba. Thanks for inviting me into your home. Right? You know her, but you're still saying thank you. It's polite. What else should I say?
Yes. How are you feeling at the moment? Yeah.
Are you feeling good? What about context? Is that a good idea here, guys? Context? Give some context.
Yes.
I'm here.
Yeah.
Yeah, I'm here.
Yeah, we don't normally say I'm aware that in a home visit. You can, but it's better to say I'm here today too. Right? So let me put that here as well. I'm here today too. Why do we say that? I'm here today too.
Purpose.
Because we know
To discuss
we
something.
should-
Discuss our
Purpose.
Yeah. Now let's go back to the criteria. What does the criteria say about that? Let's have a look. What does nature mean here? What does that mean? Nature. Here it means purpose.
The type of interview.
Yes, the purpose of interview.
Purpose of the visit. That's like a paraphrase here. So definitely in home visits, tell them why are you there? What are you trying to do in their house? Tell them. Okay. So this is our known patient. Olga, do you have a question on this? Olga.
Sorry, I have a question about the unknown patient. When we come to home, do we need to say that we are one of the nurses in the GP surgery, or we can say instead I'm one of the community nurses?
Yeah, you can change this. So you could say I'm one of the nurses in the GP surgery. I'm one of the community nurses. There's different possible things we can say here. But yeah.
Okay, so it depends on the cue card, yeah?
It depends exactly everything. And this is why, guys, this is why I'm highlighting this word appropriate.
Okay,
It depends. Everything depends, right? You cannot stop thinking. You have to think, where am I? What is appropriate here? Okay. What about clinic known patient? Is it the same, guys? Can I just copy paste? What do you all think? Hi, thanks for inviting me into your home.
No, we can't.
No, that's not
Yeah, what do
appropriate.
you mean we can't? What are we going to change?
Thanks for coming in today.
Thanks for coming to. Yeah.
Thank you can change, right? Remember, this is not essential, guys, but if you want to say thank you, it's very polite. Thanks for coming in today. Context, I'm here today too.
No, I'm aware.
How can I help you?
Or doctors,
today?
I think with doctors, it sounds very nice if you say, I can see from your notes. I can see from your notes that you're having problems with your medication. Okay. Question, Martinova, I think you've got a question here.
Oh, sorry, it was for a previous question.
Okay.
Just I don't understand.
Help me with this last one. Is it the same, guys? Hospital. Do I have the same introduction?
Not the thanks one. Thanks for coming in. So.
Again, we don't say thank you. Exactly, we don't say thank you. Okay. So if you're new to OET, this is what we're going to be practicing this week, doing introductions in different situations. Okay. Let's just play a very quick game if we have time. We've got 10 minutes. So very quickly, guys, I'm going to give you an example of all of these. Okay. And you guys, you need to tell me, did Alan do it correctly or incorrectly? Is everyone ready?
Yes.
Yes. Yeah.
I will give you an example of this now. You tell me, is this correct or not? Okay, so 3, 2, 1. Hi, I'm Alan, and I'm one of the doctors in your GP surgery. Can I just confirm your name, please? Okay, I'm here today to discuss your medication. Thanks for inviting me into your home. How are you feeling at the moment? Is it correct?
No.
No, the part that's the thanks for coming to our GP.
I thought it's correct.
I missed this. Didn't say, can I call you? Right? Everything else I think was okay. All right. Again, listen to the question, Khwaja.
You said thanks for coming to our GP surgery.
Ah, is that what I said? I thought I said
I think that's what you said, yeah.
Yeah, at first you said the cleaning after that home.
Oh, maybe I got it wrong then. Listen, guys, listen to what I say. It's possible to make a mistake here. So is this right or wrong? Listen to me. 3, 2, 1, go. Hi, John. Thanks for inviting me into your home. I'm here today to continue our discussions about your mobility. So how are you feeling at the moment?
It's correct.
Everything was
Correct. Yeah.
correct.
Okay.
Fantastic.
So I think do I get an A? But the first one I made a mistake. I think I made a mistake here. Okay. What about this one? Okay. Hi, I'm Alan. I'm one of the nurses in your GP surgery. Can I just confirm your name, please? Okay, great. And can I call you John? Okay, fantastic. Thanks for coming in today. How are you feeling at the moment?
All right.
I think
you missed
What did I miss? What did I miss?
context.
No worries.
I suppose that's okay, though, isn't it? Because it's not essential, right? Essential. Okay, what about this one? Listen to this. Hi, John. Thanks for coming in today. I'm aware that you're having problems with your medication at the moment. It's nice to see you. So how are you feeling at the moment?
Correct.
You mentioned his name, so.
I said his name. I didn't give my...
Yeah.
No, the context was not there, I think.
At the moment, you
I think I did say context.
Yeah, you did.
have problem with medication.
I said nice to see you again. Is that okay? Nice to see you again.
Yeah, because
Yes, it's good.
Yeah.
I think it's okay, guys. All right, it's okay. But you don't need to do it. You can say nice to see you if you want. Okay.
But even if you know him,
Alan,
even if you know him, you can still say his name. Hi, John. Thanks for coming. Can you not say that? Hi,
yeah,
John.
that's what I just said, Khwaja. I just said hi, John.
Yeah.
No, right?
But that's okay. Yeah.
It's okay if it's clear on the card that you know them. Yeah. Okay, what about this one? Tell me if it's right or wrong, guys. Okay, so hi there. My name's Alan. I'm one of the nurses in this clinic. Can I just confirm your name, please? Can I call you John? I'm aware that you're having problems at the moment with your medication. So how are you feeling at the moment? Correct or incorrect?
It was correct, except it was hospital.
You said clinic.
Clinic, yeah.
Okay, and the last one, tell me if there's any mistakes. Hi, John. Nice to see you again. I'm aware that you're having problems with your mobility at the moment. So can I just confirm your full name, please? Okay, great. And how are you feeling at the moment?
You know patient and
No.
Thank
name.
you.
Now, someone was asking me, can I say it? Someone was saying, can I say it? Maybe you can say something like, hi, John. Do you mind if I just confirm your name again?
Yes, that's better.
If you want to do it, if you feel like you want to do it, okay, no problem. Okay, it's
But
not...
if only you first you call surname or full name, no surname or given name. But if you at the beginning say the full name, then there is no need to again ask for the full.
I don't think so, Doz. Exactly. So just guys, just do what is appropriate, do what is needed. You don't need to worry too much about this. Okay, last thing in this class, we've got 5 minutes to talk about other situations, and this is really important now. Okay, so other possible situations we can have are schools, or so a location that is unfamiliar. This is a problem, right? Could be school, could be, I don't know, something else.
Your home, maybe?
Could be something really strange that you've never seen before. Other possible situations you might have, guys, are what if there are two people? You know what I mean? There's a child and a parent. People always ask me, who do I speak to? Do I confirm the name of the child or the patient? What do I do? Okay, these are problems. Okay, so two people. Another thing is, what if I'm starting in the middle of the conversation? Is that possible?
Yes. Yes, of course.
Yeah, there's some cards, aren't there, where you read it and it says you have just finished taking blood pressure, right? Sometimes you're in the middle. Okay, so what do we do? How do we introduce ourselves? I think these are the main things. Another difficult situation is, imagine it's a very stressful situation. Everyone knows that it's very stressful. Should I do a normal introduction? Imagine you're talking to someone whose child has just died. Should you be saying, how are you feeling at the moment?
No, that doesn't work.
These are extra things, aren't they? These are
inappropriate.
Totally inappropriate. Totally. Okay. Now I'll get Paul tomorrow. He can do more on this and the kind of things you should say. You can practice. But in general, look, if you're in a school, what should you do? If you're in a strange situation, adapt. Right? What is closest? What is most like a school here? What is most like a school?
Home.
Clinic.
I think clinic is most like a school. School, clinic, right? So you're going to have to change that one. You just change it. I can't be in the exam for you. You have to read the card and think, okay, it's not exactly like a clinic, but a little bit. You can just change it. What if there are two people? What do we do if there are two people?
You speak to a child rather
Speak to them both. Speak to them both, right? So you can say, talk to the parent and say, can I confirm both your names, please? Right? How are you both feeling today? The parent will also be stressed. So the key is to use the word both. Okay? What if we're starting in the middle of a conversation? What should we do? I'm starting in the middle. I already took his blood pressure. I'm giving him test results. I'm in the middle of it. What should I do?
Just say thank you for everything that we mentioned. For example, thank you for letting me to do your examination, or thanks for your patience.
Maybe thank you. Thanks.
Yeah, we can say thanks, but not the name. Yeah, introduction is not here.
Or we can use a bit of context, can't we?
Yeah, we can use.
So we can just say something like, okay, I have just finished taking your blood pressure.
Your blood pressure, yeah.
And then you just start the card. You don't need to introduce yourself. You don't need to do it.
Let's move on.
Okay, very stressful situation. Someone has just died. What should we do? What should we say?
I'm really sorry.
Yeah, empathy, right? Just start straight away. Like maybe you can give some context and say, "Oh, I'm aware that your child has just died. I'm so sorry. It's unimaginable what you're going through right now." Straight into the empathy, really hard, because that's appropriate, isn't it? That's what is appropriate in that situation. Okay, so guys, I'm going to finish the class here. If you're new to OET, please study this document. Try and maybe practice it with your friends tonight if you've never seen this before. Tomorrow in the class, Paul will review this quickly, and then he'll be practicing with cue cards and other things. Okay, I think I'm going to finish there. Does anyone have any questions just quickly before I go?
Yes, Alan.
Come on, Khalida.
I have a question, but not regarding this.
Okay, send me a message, Galina, because yeah, we have to finish the class now. But if you want to send me a quick email, even, okay. Right, I'm going to say goodbye, guys. Have a lovely day. I'll see you very soon. Thanks for all of your time and patience.
Bye. Thank you.